Hey guys, here is the short video of diaphragmatic openings. I have got you two images and the table and the minor openings, major openings, everything that you need to know about the diaphragm. It is a most frequently tested topic. It is a high yield zone, and this was asked in previous years multiple times. It is actually a clinically correlated topic. So I have got you a question also which is clinically oriented. Let us solve that question at the end. Now let us try to understand the openings, their level and the structures that pass through the diaphragm. I'll be teaching this like very fast because this is an easy topic and that saves your time too. So firstly, let us understand this diagram. So let's see, before understanding, the three levels that are important are T8, T10 and T12. So see guys, T8 is located in the central tendon and T10 in the muscular part of the diaphragm and T12 are in the crus of the diaphragm. So look at this part. This is the anterior sternum and this is the vertebra, right? So this is the posterior. So you have this orientation in your mind, and this white zone here is the central tendon which has T8 level, that is the venacavala level, and it also has a nerve that is the right phrenic nerve. I'll tell you the mnemonics to remember everything. Firstly, try to understand, make a pictographic memory in your mind. Coming to the next one, that is the esophageal opening, which is in the muscular part, which is at the level of T10. So here this is all muscle part, right? So that is the muscular part which is at the level of T10. Coming to the crus part, that is C. These are the crus of the diaphragm, guys. So coming to the crus part, here you have the crus and that has the aortic hiatus. Okay. So aortic hiatus is at the level of T12. So firstly, let us understand the mnemonic for the levels. Okay. So at the level of T8 is vena cava. So count the number of letters in vena cava. You will find it as 8. And coming to the T10, that is esophagus. Okay. So in the esophagus, you have 10 letters. Coming to aortic hiatus, first word is 6 letters and hiatus is also 6 letters. So total constitutes 12. So at the level of T8 is vena cava, T10 is esophagus and T12 is aortic hiatus. So the mnemonic for the level is done. So in this table, one part is done. T8 is vena cava, 8 letter, T10 is esophagus, 10 letters, and T12 is aortic hiatus. Hiatus meaning an opening or a junction of different structures passing through the same structure, right? So that is aortic hiatus, which is 12 letter word. Coming to the other structures that passes through the vena cava, here you have this yellow color nerve, right? That was the right phrenic nerve. So how to remember that? 8 and right are similar terms, right? You just have to replace E with R. So right phrenic nerve passes through the T8. So guys, this is the diaphragm and here you have the heart, right? So the right phrenic nerve, it just goes like that and enters to the central tendon via this T8 opening, which is the vena cava opening. Whereas the left one travels along the left border of the heart and just enters the diaphragm through a random opening. Just the muscular part of the diaphragm it opens. It does not open through any named opening. Just pierces the muscular part of the diaphragm and it goes like that. So the left phrenic nerve is not involved in these openings. Only the right phrenic nerve is involved. So that completes T8 for you. Coming to T10. So remember T10, right? So 10 is having O, that is esophagus. That is 10 letter. And what is the cranial nerve 10, guys? That is vagus, right? So cranial nerve 10 is also here. Here right and left vagus nerve, that is right and left trunks of the vagus nerve goes. Whereas for the phrenic nerve, it is only right. Right is 8. Coming to T12, the mnemonic is that. Remember, right? That. So T is thoracic duct, H is hemiazygous vein, A is 2, that is aorta and azygous vein. Whereas 12 is at the level of T12. So that is the mnemonic for T12, and O is for esophagus and 10th is 10th cranial nerve. Esophagus has 10 letters and vena cava has 8 letters. 8 is for right phrenic nerve. So that completes the structures that passes through the major openings. So these are the major openings of the diaphragm. Coming to the minor openings, there are 3 minor openings. One is space of Larry, second is medial arcuate ligament, and third is lateral arcuate ligament. So for the space of Larry, remember it like SP. So here it is SP, superior epigastric artery. that is space of Flary, which is the costoxiphoid cap. Coming to medial arcuate ligament, it is a sympathetic chain, whereas lateral is subcostal. So remember, like lateral has LAT in this direction, whereas subcostal has LAT in the reverse direction. So subcostal nerves and vessels are in the lateral arcuate ligament. So the leftover one, that is the sympathetic chain, is in the medial arcuate ligament. Because sympathetic chain usually lies just adjacent to the vertebra, right? We always learn that, right? So the sympathetic chain comes more towards the medial side, because in the medial arcuate ligament. Whereas in the lateral arcuate ligament, you'll have the subcostal nerves and vessels. That completes the minor openings. And here are the three important points that you need to remember. Firstly, splanchnic nerves. They pass through right and left crus of the diaphragm. Sometimes azygous vein passes through right crus and hemiazygous vein through the left crus. So usually these two are from that mnemonic, right? Which at the T12 aortic hiatus level. But sometimes they might pass through the right crus and left crus respectively. So here is one more diagram which re-emphasizes the discussed points. T8, vena cava opening. So inferior vena cava, right and 8, right phrenic nerve. T10, O for 0, 0 for O, that is esophagus, and 10th nerve, that is right and left vagus. And one more important thing, left gastric vessels are involved. So here it is right phrenic nerve, here it is left gastric vessels. Coming to aortic hiatus, that is, the mnemonic is that. T12, aorta, azygous vein, hemiazygous vein and thoracic duct. So this completes the levels for you. So here, since this T4 is written, let us discuss one point regarding T4, guys. So trachea bifurcates at the level of T4. So bifurcate spelling is BIFUR actually, but remember it like bifurcates. So trachea bifurcates at T4 level. So we have these 4 related mnemonic, guys. In the first aid they have given this C4, T4 and L4 it seems. So bifurcations are usually related to the number 4. So at the level of C4, common carotid artery bifurcates, and at the level of T4, trachea bifurcates, and at the level of L4, abdominal aorta bifurcates. So this is the mnemonic that is given. Bifurcation, C4, T4 and L4. This is like entirely different story. This is not at all related to diaphragmatic openings. Just because we have this T4 label here, I have like revised that mnemonic here. So this completes the entire discussion of diaphragmatic openings. Now answer this question for me. So a surgeon is operating on a case of thoracic aortic dissection, suspects that the dissection might have extended into the abdominal aorta. So he goes down and explores the aortic hiatus to localize the extension. Which of the following structure is present here? So that here is aortic hiatus. So what are the structures present in the aortic hiatus is the basic anatomical question which is clinically correlated with the aortic dissection. So please let me know in the comment section, guys, what are the structures that are present in the aortic hiatus. Thank you. I'll be waiting to correct your answers or to appreciate your answers in the comment section. Bye.